for me that I can stay in the room, stay present with them, but stay self-aware and self-regulated. I have to stay grounded in what I would call my own okayness. So I can witness their feelings, I can support their feelings, that cognitive empathy, but I can add that piece of that warmth and caring and tenderness. I want things to be better for them. If there's something available for me to do to help that happen, I will do it. And may be able to select a little more skillfully because I'm in that compassionate state. But I'm also very aware of my separateness and my own okayness. That is compassionate empathy. And again, that is a different emotional and neurological state in my brain than empathetic empathy, emotional empathy, or empathetic distress. So zooming through this, what does compassion feel like? Well, that's a very subjective experience, but I often use my college students as guinea pigs. And we were talking about this as I was preparing the first of these presentations. And we were talking about what compassion feels like for them. And some of them came up with some words that I thought were a really great start to begin thinking about this. So a feeling of warmth, like physical warmth, like your heart is just warm. Some people will describe a sense of expanded awareness, or feels like your heart is expanding, like kind of like the Grinch. You know, your heart is like getting bigger. Sometimes a sense of hopefulness that no matter how profound the pain or the distress is that you are sitting with, the belief that someday this pain can be better, the belief that someday this person can heal or accommodate some of what they're struggling with. Now, that may be apparent to you, kind of like that road through the mountains. Maybe you can see it, maybe you can't. Maybe you'll be a part of that process, maybe you won't. Maybe you're just witnessing with them. But that sense that I believe that in time this can be better. There's often a sense of calm and peacefulness that comes for me. And there's also a sense of flow, like I have all the time in the world, you know, that things just kind of open up. I have learned to recognize when I'm in that compassionate empathy stance, when I experience some of these things inside myself. Now, when we talk about trying to reach that during a time of stress, and for many of us, as I've mentioned, that might be things that you're dealing with at work, or many of us are witnessing and trying to support a lot of pain and fear in our personal lives, in the our friends and family. I wanted to give you guys two strategies, one of which is really just a regulation strategy, and that's just to sort of get yourself moving out of that hyper or hypo arousal, out of the blue zone, out of the red zone, back into that white zone, that window of tolerance. And so we're going to do this now together, and I invite you guys to join me if you want to. If you don't, it is 100% okay not to do this. This is something called the relaxation response, and this was discovered by a doctor at Harvard who was studying, this was decades ago, studying how his patients who were dealing with high blood pressure or diabetes or heart disease, how they could start to lower their stress. So he would have them do this breathing technique, and he discovered something kind of unexpected about it. So we're going to go ahead and jump into the breathing technique, and then we'll talk a little bit about that. So again, I invite you to join me if you choose to. If you've been kind of multitasking during this training, and I will not tell on you, go ahead and stop doing your paperwork, put your phone away, all of that stuff, and just...
They don't have anything. Can you end and go to you? Are you done with the slides for now?
I guess so. I don't know what you're telling me. They have no slides?